All right, good day to you over there. Uh, Obviously, it's Dr. Tolu Ajibade back again with a new video, which I've titled The Levels of Prevention. So, as we all know, the levels of prevention is a section of the MDCN, that's the Medical Dental Council of Nigeria's examination, the OSCE part to be precise. And so, we'll be touching a little on that today. And and we'll be using malaria as a typical example. So at the end of explaining what it really entails, I'll be talking about malaria and adapting that to the levels of prevention. Is that all right? Okay, so basically, um, I told you it's me, so get ready for an experience. Are you ready? Are you ready? All right, let's get into it. So, as we all know, the levels of prevention entails, or maybe we don't know. I don't know. I can't be so sure. So basically, the levels of prevention uh, involves 5 steps, and most times you are tested. That's the first question that comes out. The question could say, "So, could you tell me about the levels of prevention for the Zika virus?" Okay, could you tell us about the levels of prevention? And then you say the levels of prevention. There are 5 steps to that. We have the general health promotion, and we have the specific prophylaxis, which is the next step, and then you get to early detection, diagnosis, and treatment. Limiting disability as the 4th step, and rehabilitation, which is the 5th step. So let's talk a little about the general health promotion, because this is how it works. Yeah, a question comes out saying, "Tell us about the levels of prevention," and then you talk about the 5 levels. There are five. Oh, good afternoon, Mark. Good afternoon, sir. There are 5 levels of prevention. We have the general health promotion. We have the specific prophylaxis. We have. So you state those 5 I just mentioned now, and then they tell you, could you adapt that to a particular disease? We'll be using malaria here as an example. So let's talk about the general health promotion. We'll be talking about what it involves, and then citing malaria as an example. Let's get into that. So, general health promotion, what does it involve really? It basically involves measures that we take in preventing the onset of diseases, to making sure that diseases do not occur at all in the first place. So, what we target are healthy individuals most times. We create awareness, we educate the community and educate individuals, and on basically how to ward off the disease, how to make sure it doesn't come to fruition, it doesn't become doesn't come alive, basically. And how do you do this? You mentioned the fact that you'll be doing all of this through mass media, social media, conferences, symposiums, town hall meetings, television. Okay, I've mentioned mass media. Yeah, so you mentioned basic things like that. And so imagine we are talking about malaria as an example now. So for the malaria example, what I'll be doing is talking about malaria. I'll say for general promotion, I'll be educating the community and educating individuals, making them understand what malaria is, making them understand it's a disease caused by the Plasmodium falciparum here in Nigeria, and it is spread by a vector, which is the female Anopheles mosquito, and making them understand that it can be warded off by maintaining constant hygiene, by maintaining good hygiene, and maintaining a very clean environment, making sure there are no stagnant waters in their environment, and making sure that they keep themselves safe by wearing long sleeve clothes and using insecticide treated nets and things like that. So I'll be doing all of this through mass media, educating them through mass media, through social media, through symposiums, through conferences, banners, and the likes. So that's it for the first step. So let's get into the second step, which we can see here as specific prophylaxis. So what this involves is talking about specific ways. When we say specific, we mean really directed and targeted at that particular disease. Specific ways of, did I say specific? Specific. Specific ways of actually making sure this disease doesn't occur. So we're going beyond the general hygiene and the general community health, and making sure that we really directly focus on the prevention of this disease. And we do this through vaccines, nutritional supplements, and the chemoprophylaxis. So, as I mentioned, nutritional supplements, chemoprophylaxis, these are drugs and the likes. So, let's talk a little about vaccines, okay? So, for the vaccines, you need to mention specifically if there are vaccines that have been made to target this disease. You understand? Uh, if it's the measles, you mentioned the MMR vaccine. You don't just say MMR, you say the measles, mumps, and rubella vaccine. You know, if it's malaria, is there a vaccine for malaria? Quick question. Nope, there isn't. So you would say there is no specific vaccine, and but if there is, you have to talk about when it is given, how it is given. How? Okay, let's just focus on when it is given and how many doses should be gotten. Okay, for example, if it's the tuberculosis vaccine, you need to mention directly that you give the Bacillus calmette-guerin vaccine at birth. You understand? And if it's things like the polio vaccine, you mention the oral polio vaccine at birth, then you mention the oral polio vaccine at 6 weeks, at 10 weeks, 14 weeks. No, 14 weeks, yeah, you give the oral polio vaccine and you give the inactivated polio vaccine intramuscularly. So you need to mention all of these things and the date for that particular disease. So this will involve you having to learn the basic diseases and focus on the vaccines that could be used to ward that off. Okay, let's move on to the nutritional supplements. So, as we all know, there are some diseases that can be avoided by a few supplements. For example, thyroid diseases, where you could ward that off with having iodized salt. That's salt with a substantial amount of iodine in it. And then vitamin A for measles. Vitamin A actually reduces the severity of measles, so that could also be a nutritional supplement. And vitamin A is also used as a vaccine at 6 months. So you mention things like that if that exists. You understand, yeah? And then chemoprophylaxis. You know, there are some diseases that can actually be warded off by giving prophylactic medications. Like we all know, for pregnant women, like I mentioned in the video about, clerking, obstetrics and gynecology clerking, where you talk about giving sulfadoxine pyrimethamine. That's Fancida to pregnant women as an anti-malaria prophylaxis. So you could mention things like primaquine, mefloquine for malaria, self-triaxone for syphilis, and the likes of that. So if there are drugs targeted to prevent the disease, you use that. Just like when you come into Nigeria and you have been abroad, because basically if you've been abroad for a while and then you're coming back to Nigeria, your body isn't used to the insect bite, the mosquito bites, and the malaria. So sometimes our parents give us or we use uh, sulfadoxine pyrimethamine. Yeah, I keep saying our parents because despite the fact that I'm a doctor, my mom still feels she's a doctor, even though she isn't. She's a teacher, so she still feels she's a doctor. So I keep saying that. Okay, so so that's what we do. And then, so that's it for specific prophylaxis. We'll be moving to the early detection, diagnosis, and treatment. So let me cite an example for malaria. So after mentioning the general promotion part for malaria, I say, okay, and then the next step is specific prophylaxis. So there's no particular vaccine for malaria, but I'll be making sure that people adhere to rules of prevention, things like maintaining a good environment. So I kind of reiterate what I mentioned in the general health promotion so that space doesn't seem blank. You get what I'm saying, yeah? And then we move to early detection, diagnosis, and treatment. As you can see from here, I have the clock here. Why is it 10 past 10? Okay. Anyways, that aside, it means you need to be right on time. Make sure you detect this disease as early as possible and diagnose it as early as possible so you can achieve the best health outcome, which is full recovery and reducing the spread of this disease if it's a very communicable disease. You get what I'm saying? So this involves screening high-risk groups for early signs of the disease, like For cervical cancer, you screen uh, for CIN. You screen for that using the pap smear, as we all know, the Papa Nicolau smear. Yeah, and that reminds me, if you're mentioning, I don't know for pap smear seems to be the colloquial term. But for things like BCG, if you notice when I mentioned BCG earlier, I said Bacillus calmette-guerin. When you mention the vaccines, make sure you mention them fully. Don't just say BCG vaccine. They're like, hello, I don't know what that is. So just to show that you know what you're talking about. You know what I'm saying, yeah? And then so you say so things like pap smear, HIV tests, routine HIV tests for people who are at high risks for of this disease, like people who have a particular sexual orientation, people who are sex workers, people long distance travelers, um, people who engage in unprotected sex. And then pap smear for the age group, I think it's between 21 and for the reproductive age, 21 to menopause. You get. So you screen people for that. For malaria, it's headaches and joint pain and feeling general constitutional symptoms like fever, tiredness, malaise, and the rest. And for things like measles, the three C's, which are coryza, conjunctivitis, cough, and then maculopapular rash. Yeah, so you screen for things like that, uh, Koplik spots, all of those things. And then you also monitor vulnerable people like pregnant women and children. Because, children are at a higher risk for lung diseases, that's why we vaccinate them, because they've not been sensitized to any of this. They're coming from a very sterile environment, and they're like, we're coming into this shitty world, we have nothing, no immunity. So basically, that's what that does. So you screen risk groups for that, and that is what it really involves. So for malaria, I'll be screening the community for early signs of diseases like fever, joint pains, tiredness. So just mention, if you don't remember anything, at least mention the constitutional symptoms. Just have like 5 of them and just mention them. And then you'll be fine, you'll be good to go, because most times those are the early symptoms of diseases. And if it's a particular disease, you need to focus on that and then mention it. You understand? If it's tuberculosis, just mention symptoms of tuberculosis: cough, night sweats, drenching night sweats, things like that. Let's move on to limiting disability, which is the fourth step. We're almost done with this, so quick. So what does limiting disability do? It's aimed at limiting disability. Some people call it limiting damage. So that's another thing I should mention. Some of these names, it's not the name that matters, it's the idea behind it. So some people call it early detection, diagnosis, and treatment for the third step. Some people say early diagnosis. Some people say early diagnosis and treatment. So don't get carried away by all of that. It's just semantics and the rest. So for limiting disability or limiting damage, it's aimed at, it's self-explanatory. It reduces the damage that has been caused by the disease which has already occurred. So you weren't able to prevent it, nip it in the bud. You weren't able to give specific prophylaxis, and it happened. So how do you limit the spread of this and limit the recurrence of this? So that's what it involves. So it involves dispensing specific drugs. So focus on the word specific, emphasis on that. So dispensing specific drugs to cure this disease. So basically, for malaria in this case, it's the ACT, which is the artemisinin combination therapy. If your question is given on malaria and you do not say ACT, man, what do you then say? You understand? So you have to mention the artemisinin combination therapy, where you give either artesunate, artemether lumefantrine, artesunate lumefantrine. So you mix these two. You mix an artemisinin drug with another group of drug, and that is very important. Once I mentioned that in my exam, the lecturer just smiled and gave me my mark, and I was happy, and everybody was happy. So learn specific drugs for specific diseases. If it's tuberculosis, Come on. You got to mention the RIPES drugs, at least the first three, RIP, which is rifampicin, isoniazid, parazinamide. I keep mixing that up with something like that. I guess it's how I learned it. So you have to mention these drugs. Treat them with this, the first three does, and etc. And then rehabilitation. Let's imagine a case where the person, you've been able to cure the disease, you've been able to limit it, you've been able to make sure this person is fine. So, how do you get this person back into the society? How do you get this person back on his or her feet? How do you get this person back to the normal pre-disease state? I think I wrote that somewhere. Yes, I wrote it. So that's what this involves. It involves things like, so you have to mention, just for the sake of mentioning it, just say I'll be putting this patient under physiotherapy, doing social therapy, talking to the family and the friends of this person, making them understand the cause of malaria and making them understand that it's not the end of the world and this person can live a fine life and a quite all right life. Social therapy, that's social therapy. For drugs that affect the speech, you mentioned speech therapy. For drugs that affect joints, you mentioned physiotherapy, like tuberculosis, Pott's disease, for example. And yeah, I forgot to mention, for the limiting disability, uh, after mentioning the particular drugs, you also mentioned that you'll be doing all of this in a bid to avoid complications of the disease. So if you know complications of that disease, just mention one or two. I just got reminded of that by mentioning Pott's disease and tuberculosis. So just mention that, and they're like, "Oh, you're good, you're all right." For malaria, I just mentioned that you'll be giving these drugs to avoid complications like severe malaria, especially in children. For Zika virus, mention things like avoiding things like Guillain-Barré syndrome, which is Guillain-Barré here, uh, neurological stuff, damage of the neurons. So things like that. So you mentioned all of that, and then back to the physiotherapy, back to the rehabilitation. You mentioned physiotherapy, speech therapy, social therapy, occupational therapy, just to get this patient back. As you can see in the pictures down here, we have the chairs around round session. Is like these what's it called, support groups. So if the person had a disease that really was messed up the person's life, you could get the person into a support group. You could get the person to the gym. If the person had diseases that affected the limbs, maybe things like all this arthritis and the joint diseases, you get the person to the gym, get the person back on his feet and back rocking. So that's the fifth stage. And basically, there is no particular way to adapt this to any disease. Just mention all of this I've mentioned, as you can see here. So I'll say I'll be doing things like physiotherapy, speech therapy, social therapy, occupational therapy, just to get this patient back on his or her feet. And that's all they need to hear. And you get your full mark for one whole station. So one other thing I would like to mention to round this up is for levels of prevention, do not focus just on malaria or just one disease or two diseases. Listen, there are diseases that will be out in the news during that period of time. It could be diseases like currently we were thinking yellow fever, we were thinking yellow fever, gastroenteritis. I think we're thinking, so basically things like that. So focus on the news, listen to the news, because the question came out, and the question was on infectious disease and community medicine. The question came out, and the question was like, are you aware of any disease that is about being eradicated in Nigeria? What disease was eradicated at 2000 between 2014 and now? So if you're not listening to the news, if you're not really current, you will be taken aback. You'll be bewildered. You'll be lost, basically. So learn a lot of diseases. Don't just learn far and wide. Don't learn diseases that are in other parts of the world. Doesn't matter. Focus on Nigeria. What are diseases that have constantly beset us as Nigerians? And talk about that. If you're lucky and there is an outbreak, learn it very well. Learn basic diseases that are endemic. Know the difference between endemicity, endemic, and pandemic. Know the difference between that. Know what an infestation is. Understand basic refuse disposal, water disposal, sources of water, things like that. Refuse disposal, sewage disposal. Learn those things. Have a basic knowledge of community medicine, because I can tell you, believe you me, about 2 stations out of the 10 in OSCE come from that. So know this pattern and then learn diseases far and wide. Okay? And I wish you the very best. I know you're gonna be smiling at the end of the day, just like this girl in this picture who is so shy, still covering up a smile, but she's happy. So I believe in you. I know you can do this. I know you're gonna be a great doctor at the end of the day. So focus, be determined, be dedicated, stick to a pattern, learn, study, pray, and you will be fine. Thank you very much for watching. Don't forget to subscribe to my channel. I'll be releasing more videos. I got mnemonics for days. I got acronyms for days. I got instructional materials, making it as interactive as possible for you. So I'll be expecting you to subscribe. And don't be that bad friend that doesn't tell the friend about something as good as this. Talk to your friend about that. Tell them, oh, you're graduating next year. Start watching these videos from now. Oh, you're planning to write the exam. Start watching these videos from now. It's Dr. Tolu Ajibade. I hope and I believe you've had an experience. Have a good day. Thank you.